So ACH is our Advanced Care at Home program that Mayo Clinic has partnered with Medically Home on to care for hospital level patients in the comfort of their home. So these are people who are sick enough to traditionally be cared for in a bricks and mortar hospital, but we're going to leverage a lot of resources and tools to actually now take that patient and get them into the comfort of their home and take that Mayo expertise to supervise all that and do it while the patient's at home. The key foundation principle here of Advanced Care at Home is that anything we can do in the hospital, we need to be able to provide that same service in their home. That could be anything from meals to radiology studies, to lab draws, physical therapy, nursing care with wound care, delivery of medications, social work, chaplains. All of that is arranged so that we can provide those same services in the patient's home. I think about patient satisfaction. So you're in the comfort of your home, you have the privacy of your home, your familiar environment. One of the things that we see in the hospital is that people can sometimes become, disoriented or confused because it's a foreign environment for them, and putting them at home will make them much more comfortable. So I actually think that's one of the great things about Advanced Care at Home is that we get to see the patient in their natural environment. They're not in the hospital where I'm delivering them that low sodium diet. I get to see what they're actually eating. When our nurse practitioners or physician assistants go into the patient's home, they get to see that bag of chips sitting on the counter. And those are observations that we can't make from the hospital setting. And so I think you can actually glean a lot more about the patient and about what's going on in their normal life, where we could potentially make some intervention that will make a difference for that patient. At the touch of a button, you have a video and audio connection with the command center nurses and physicians and NPPA team. The patients will have a watch that they can wear so that if maybe they had a fall or something and couldn't get up to the screen to push the button, now they can just touch their watch to connect. There's another device that can go by their bed. Again, at the touch of a button, they can get an audio connection. And so there'll be multiple touch points throughout the patient's home where they can get in contact with the command center, with the nurses, with the physicians. And so they'll still have that ability to reach out. I would say that the other piece of this is that this is an opt-in program. And so the patients have control. They can choose to participate in the program or they can choose to not participate in the program. To me, I think one of the amazing things is the ability to take the expertise of Mayo Clinic and get it into the patient's home. And that's not only just the physician, that's also our Mayo Clinic nurses, that's our Mayo Clinic nurse practitioners and physician assistants. And whether that's a virtual connection with the patient through a tablet or it's an in-person visit with our nurse practitioner or physician assistant, we're getting that Mayo Clinic expertise straight to the patients in their home. And I think that that's one of the great things as we're expanding the access to Mayo Clinic and our experts. So the idea of hospitaling at home or taking care of hospital patients at home has been around for a long time, but it's only catching on now because of the technology abilities that we haven't had before. And I only think that that's going to grow as we look at the possibilities for technology in the future, and having more interaction with the patient, more ways to assess and monitor the patient in the comfort of their home. That's why I think it's the future. I think it also has the potential to decrease cost in healthcare because of the tremendous expense it takes to have a bricks and mortar hospital. If now we can just turn that into a technology platform that can be in the patient's home, we're going to get rid of a lot of that cost that exists now. But I think that we're just in the infancy of advanced care at home, and I think that the sky is the limit as far as what the possibilities are, but also growing that patient population as to who might be able to participate.